So let's take this patient through that. So primary symptoms they were talking about is fatigue. They're having a lot of gut distress, like poor digestion, a lot of gas, bloating, symptoms like that. They weren't feeling their best at work, weren't productive. They're getting brain fog a lot. And they're really sliding behind work, and they were honestly fearful of losing their job because their productivity and what they were doing in their position has really lagged over the past couple of years. So they really started getting put under the microscope at work. That started their path and their journey towards trying to figure it out so they could take control back, do the things that they need to do, but they just weren't getting the right answers. So here's how I suggested we walk that person through this, and we're going to be doing that as a patient when they come in and see me for a consult. But I'm going to take you through their consult kind of in advance. Here's exactly how I would look at that. When we talk about those conditions, we want to look at three big pieces here in this preparatory phase because it relates to these underlying systems in the body. Because again, we're not treating symptoms. We really want to look for system dysfunction, correct the system dysfunction, get that system back online, healing, repairing, functioning optimally, and then guess what? Symptoms will likely go away. So if we dive into this, GI system, we think about our gastrointestinal system or our gut. We're eating things multiple times per day. Are we putting the right nutrition in our body? Is it possible that nutrition is helping us or hurting us? Do we really know based on how we feel? In this patient's presentation, I suspect that they could be having some food sensitivities, allergies, or some nutritional depletion and deficiencies based on some of the medication they shared that they were taking that could be depleting their body of what it needs to function at an optimal level, right? To be energetic, to have good clarity of thought and be able to power through work and not feel tanked at the end of the day where they go home and they literally have to collapse onto the couch because they have no energy. They can't play with their kids, they're checked out when it comes to their family, and it's no way to live. So let's look at this. Through the preparatory phase, again, that I-MEN formula that we use in the PRO-MEN process, we're going to look at the mindset. And this patient has the mindset. I don't even have to go there. They're going to do what it takes to get their health back. Environment. So we're going to look at the systems now in the body. We're going to start with the GI system. So what you take into the body nutritionally multiple times a day will get broken down into smaller and smaller components and eventually be digested through this cell wall. So that's what I'm depicting here, a few cells. We take the body down to this cell level. We got to be able to build this nutrition, break this nutrition down and send these building blocks through the digestive system, through that gut wall into here in the red here, which is the bloodstream. And then this nutrition can take off, right, to feed the body where it needs to. So now this nutrition is going to get delivered to multiple systems in the body. And we break those systems down. We're talking about tissues, and we break it all the way down to the cell level. Now this nutrition has to get here inside the cell. So if we're not getting cell nutrition and we're not getting optimal nutrition into those cells, well, guess what? It's pretty simple. The cells are not going to function their best. So we got to make sure, number one, we're putting good stuff in the body. Whole food nutrition, right? Get rid of the garbage, get rid of the chemicals, get rid of the artificial fake stuff that we're putting into our bodies that may be just so foreign to our body that in and of itself is taxing its ability to digest and deliver good nutrition to these cells so they can function at their best. So that's number one.